Our country is traditionally very hierarchical, and what we are doing is breaking down those hierarchies. And the way the new world is going to be, and the healthcare world especially, is going to be very fluid. And this training basically enables that.
Today's guest is Irfan Khan, CEO of Evercare Group, who expanded a global healthcare network across South Asia and Africa, and now leads the Evercare ecap Leadership Transformation Program, developing future healthcare leaders across emerging markets.
How have you been able to manage these two different cohorts, especially with physicians that need to be in the front line and yet still commit to a program that requires commitment?
So what we have is two cohorts, one of administrators and one of caregivers, but we do get them to engage with each other and interact. Now, clinicians and caregivers are obviously very busy, but when they know the benefits of what this training is going to do for them, they definitely carve out time to do this.
This is a significant investment to your people. How are you addressing retention?
One of the key sayings that I have is you should train your people well enough so they can leave, but you treat them well enough that they don't want to leave.
Any advice to investors, independent hospital owners across these emerging markets?
The advice I would give is
Welcome to episode 3 of Leadership Within. Thank you, Irfan, for joining us again. Irfan is the group CEO of Evercare. Let's talk about the impact and the outcomes of the program so far. What outcomes have we seen from the 2024 program, specifically with some of the cohort members that you have that are still with you today?
The 2024 program was our first one. It was the first year, so we were not sure what we're going to see from here. But I'm really happy because I feel proud because we've developed young leaders, and I see them now doing their work, doing their jobs, being, feeling empowered, being accountable, showing results. And there's plenty of examples within, our countries, various countries in Nigeria and Kenya and Pakistan, where you now have these young leaders who used to be shy, who used to be a bit timid, but now are sitting up at the table, speaking what they know, not being afraid, not being shy, and actually talking a lot of good stuff and actually mentoring their own teams as well. And more importantly, I think, the transformation is not just at work. The transformation is even at home. And so some of the team members we trained, I've even heard from their families to say that they have seen a transformation in the person's nature, behavior, even at home. And so, that's a positive. And I think what we have done is not just improved the careers of these people, but also their lives and the lives of their families.
What are your thoughts on how we can actually scale this, both regionally and even take this to not only frontier markets, but growth markets? Because, the groups across the established markets they don't have these systems in place. They're not executing such programs.
So I think there's a huge potential to scale. It is tough though. And I think what it will require is public-private partnerships. It would require further partnerships with other organizations. What we are building now is a proper program in the second year. We are using the trained people from the first year to also, mentor their colleagues in the second year. And I think one thing that I want to bring up also is the fact that the trainees are from various levels of the organization. They're not just from the top of the organization or the bottom. They're from every level of the organization. And so one of the benefits we have also seen is the cross-departmental or the cross-functional benefits that we are seeing. Nurses talking to managers, doctors talking to nurses. And these relationships are very important in the work environment. But sometimes these relationships are not, nurtured. And this program is helping nurture those relationships. So the program may have a curriculum that is being taught, but then there's many things around it that are actually maybe even more beneficial. So scaling it up, needs to come from further partnerships. I think public-private partnerships, what I'd really like to do is start talking to the public sectors in our countries to see how the government can benefit from this, because that is how we'll be able to get then wider impact and also demonstrate that we are in these countries, for the benefit of the people of these countries.
Irfan, what are the barriers and the enablers to scale such a program?
In these emerging markets, there's a lot of barriers. There's, funding issues. There's timing issues. I mean, one of the barriers is that we are extremely busy operations. There's a lot of firefighting that happens on a day-to-day basis on the ground. In that sort of environment, how do you then take time out to train and take people into sort of this kind of training and get their thinking, into the training? So those are real challenges. Those are challenges that maybe people don't see, but they're true and they're real. They're right there, and we are working through them. The other challenge is also just understanding and letting people know that leadership is not just at the top, and leadership is throughout the organization. And so this is a cultural change that we are now implementing and bringing in, is letting people know that it doesn't matter where you sit in the organization, you can be a leader. And the last thing I would say is that the leadership, and I can give you my own example as the group CEO, I am very tuned into this training, the people who are being trained. So even away from the training, I'm engaging with them, talking to them, listening to them, understanding, and then bringing back, feedback to adjust accordingly and really make it work for them, listening to them, and then making it work for them. And that actually helps the whole process. But, at the end of the day, I also need to be patient to see the results, to see how this is going to pan out. And this is it's not a quick win. It's not a sprint. It's a marathon.
And what's challenging, I can see, is the content of the program has to be customizable to both administrators and clinicians, or allied health, what we call caregivers. How have you been able to manage these two different cohorts, especially with physicians that need to be in the front line and yet still commit to a program that requires commitment?
Yeah, I mean, again, it's one of the challenges. So what we have is two cohorts, one of administrators and one of caregivers, but we do get them to engage with each other and interact. The cohort of clinicians and caregivers is a mixture of consultants, medical officers, nurses, allied health professionals. So it is across the sort of technical healthcare landscape, but then they also interact with the administrative group. Now, clinicians and caregivers are obviously very busy, and our focus is always on the patient, and the patients come first. Patient safety comes first, quality, ethical care comes first. But we do encourage them to take time out and make sure that they participate fully. It is a challenge, and sometimes we do find that some of them will struggle. But what I have found is that when they know the benefits of what this training is going to do for them, and they can feel the benefits, then they know that this is actually going to help them in patient care as well. This is going to help them nurture relationships within their teams. This is going to help a surgeon, for example, to do his job better and to understand his team better and to gather the people in the operation theater better and to lead, as a surgeon is a leader in the operation theater. When the patient's on the table, the surgeon is the leader. The surgeon will then know how to lead better. So once they get that and they understand that this is actually going to help them, even in their technical work and the surgeries or patient care that they're giving, then you see much more commitment, and they definitely carve out time to do this.
And this breaks down these silos, right, across three different operating markets. You're creating cross-pollination. And that's the next, from my perspective, I guess, the next logical step to creating clinical integration, where you've got certain heads of certain service lines, not operating within their own respective asset, but are able to impact your entire portfolio.
Absolutely. And I think that's a very good point, because, one of the things I have seen is that, our countries traditionally are very hierarchical, and what we are doing is breaking down those hierarchies. And the way the new world is going to be, and the healthcare world especially, is going to be very, very, very fluid. There's going to be very less hierarchical, structures, and everyone has to sort of work together. And this course, and this training basically enables that. It teaches them that. And because they're all being trained together, it makes it easier for them to then understand each other. And then when they go back into their workplaces, it's the norm. That's the way it's done. And that in itself has patient outcome as one of the key drivers, one of the key outcomes, positive outcomes.
This is a significant investment to your people. What are you doing to try and ensure that, after you've invested a year program of developing these caregivers and Evercare leaders, how are you addressing retention? Because you've built you've trained them, you've developed them, and then the competition is struggling to attract talent.
Absolutely. So what we have seen, what I see is that as we train our people, they become hotcakes in the market and they get poached and they would move. Now, that is something that we have come to terms with and understood that what we are going to be doing as Evercare, as an impact fund and to do well in these countries is we will just develop a pipeline of talent. And even if they do leave us and go somewhere else, we are actually proud of that because we feel that we have helped that economy, that other organization or that country because we have trained someone and they've gone better. So we have helped that person because they've gone for a better job and we have helped the economies. And I think that to me is absolutely key. So we are not afraid of people leaving us. One of the key sayings that I have is you should train your people well enough so they can leave, but you treat them well enough that they don't want to leave. And I think that to me is key. So I have seen examples of people who we have trained and they have had offers of 3 times the salary that we are giving them. And yet they come and show us and say, here's the offer that I have, but I don't want to go because I'm treated so well here, because I have so much respect in this environment. I really want to stay here. Because you have trained me, I don't want to go.
Excellent. Parting question to you, Irfan. Any advice to investors, independent hospital owners across these emerging markets? How should they address this? How should they initiate such a program?
If the focus is on the people, then everything falls into place. And it sounds simple, but it's not as simple as that. So the advice I would give is to say, focus on the people. Focus on how do you groom those people? How do you change the lives of those people? How do you make them better people? And that itself will gain loyalty, empowerment, accountability, and leads to better patient care, better clinical outcomes, quality, ethical care, community engagement, volumes and revenues.
Irfan, thank you very much for joining us on this podcast series. Your insights have been valuable and we look forward to continuing to work with you.
It's been a pleasure. Thank you very much.